What do your current actions say to your consumers? If you're not including them in documentation, it means that, hey, are we really valuing their opinion? Are we really including them in their own care? Is it really client-centered? And for most teams, what they're finding is that it's not. And by switching to collaborative documentation, it's making a huge difference. How we describe the practice matters. In the old days, it used to be called concurrent documentation, which meant the client sat there while I did my documentation. We intentionally call it collaborative documentation now because it's about me engaging with the client. It's about me saying, hey, here's what I heard you say. Did I get that right? Here's what I thought we accomplished today. What did you think we accomplished today? But does that make sense? Is that it's really about how we tie this together. Now, what's been interesting is there has been a misnomer, and I just want to call it out, especially for today's webinar, that we've had some folks that have thought, hey, you can't do collaborative documentation and AI at the same time. That is not correct. What we're seeing in this regard, when I'm doing collaborative write-ups, ultimately it actually helps my staff to be able to know what to write and to be able to pull excerpts from the session we've had to be able to know what we want to capture in that note together. And so that's where they actually work really well hand in hand. And one of the reasons why we wanted to come together and talk about this today. But when you look at things like progress notes, for example, it's about writing the last 10 minutes of the session. It is not writing the entire treatment session. And that's really important, team, because a lot of times when people look at collaborative documentation, they have a misnomer or misunderstanding of what it's about. Again, it's really about doing things at the end of the session.